Good afternoon. My name is Tony Price, and I am a member of the class of 2020 of the Emerging 100 of Atlanta. Thank you for joining me today to talk about the journey that I've had along my career. For my educational background, when I first got to college, I started off as an exercise science major. In this particular program, I was really interested in learning how the human body worked and how people could really achieve their maximum potential via physical activity, exercise, and fitness. When I finished my exercise science degree, I went on to get a master's degree in exercise physiology. In this degree program, this was kind of added to the exercise science program where we learned more about the human body. We focused more on human physiology and how energy systems work in the body. And currently, I am working on a doctorate of public health with a focus on chronic disease prevention. These different degrees have helped equip me with the skill set that I have now by exposing me to different things that I previously had not known about, by teaching me how to do research, by teaching me how to ask the right questions and how to go about finding the information that I need to be successful. My current title is a research associate two with the Georgia Health Policy Center. My normal responsibilities is I provide technical assistance to rural communities across the nation. And in these rural communities, they are recipients of grants from the Federal Office of Rural Health Policy. What they do is they apply for different grants, whether they are trying to create health networks in their communities, whether they're trying to put on different programs in their communities. And my office, we provide technical assistance to those different grantees. By technical assistance, what I mean is we provide these communities the resources that they might need to be successful. We help them build capacity to do things that they couldn't do prior to having this grant. And we help them a lot with strategic planning and making sure that the vision that they have out for themselves is the correct one and that they are on the correct journey. A key moment of exposure for me that led me down this current path was actually when I was in grad school. I went on an alternative spring break trip. And what that is, instead of the traditional spring break, we went on a spring break that was geared around community service. This particular trip, we focused on childhood obesity prevention in the South Carolina area, and then I did another one in Nashville, Tennessee. On both of these two particular trips, we focused on childhood obesity and prevention, and that was really my first exposure to public health. That is when I learned what public health is, what the different functions of public health are, and how my unique skill set fit within public health. The roadblocks that have kind of presented themselves to me along this journey, as I mentioned before with my degrees, I started off with exercise science and exercise physiology and then made the transition to public health. A roadblock that presented itself was trying to make that transition. And it proved a little bit difficult simply because there are not very many exercise scientists in the public health career field. There are a lot of people who are aware of fitness, physical activity, but not that many people who are exercise scientists. So one thing that I really tried to do to integrate myself into the public health community was find where my skill set fit the best. And what I found was that in the area of public health known as chronic disease prevention, exercise is one of the many ways that people can help prevent and delay chronic diseases. So, being a specialist in one of the areas that people already know about really gave me a leg up and really showed the value that I could bring to the public health field. And I think that, in combination with some various other experiences that I've had, has really showcased and highlighted the need for more people like me in this particular field. A couple of different things as well that I would say helped me make that transition, in addition to what I just said, is the connections that I have made. So, being able to network with various people that I have gone to school with that are in the career field themselves and that have really kind of gone the way that I want to go. So, making those connections and then simply doing the work. When you're networking, if you say that you're going to do something, it's really important that you actually follow through on what it is that you say you're going to do. So, actually following through on my word and doing the work that I said I was going to do has definitely helped overcome a lot of obstacles that are in my path. Outside of my actual career, kind of my purpose is getting people healthy by any means necessary. That is something that I am very passionate about and something that I think the world can benefit from. And the discovery process for that, as I was growing up, I got a chance to see how a lot of members from my own community were suffering from various chronic diseases, things that, for all intents and purposes, were otherwise preventable. So that is kind of the catalyst that caused me to want to get into this field, and even more importantly than that, stay in this field. And then finally, some advice that I would give to anybody looking to travel down the career path of public health. As I mentioned before, actually do the work. If you say you're going to do something, follow through on it. If you're going to network with somebody, follow up with that person, network with that person. Secondly, find the part of public health that you enjoy and dive deep into that area of public health. And then finally, network, network, network. Public health is a very small field, and there are a lot of people in this field who know each other by something as simple as maybe 2 degrees of separation. So don't be afraid to get out there, showcase your talents, meet people who are in the field that you want to be in, and you will be successful as well. Thank you so much.